Okay, the name of this video is Why Does Medical School Suck So Bad? Now, I sometimes do tutoring. I sometimes tutor college students or medical students. Friends sometimes send me their kids to tutor or ask me questions. I sometimes also get medical students that just trail me around. They call it shadowing for a couple hours. And I had a medical student recently who was asking me questions, okay? They always got a lot of questions. They want to learn. It's kind of fun teaching medical students because they're so bright-eyed and bushy-tailed. They want to learn. They're eager to learn. Versus a lot of older people, they could give a rat's ass about learning anything, okay? So anyways, they said to me, why does medical school stink so bad? They go, everything is all disconnected. We have to memorize tons of stuff, but we don't really know how to help a patient. It's not really clear how it's clinically useful. We just memorize stuff for tests. But the way you teach, it's totally different. You connect everything. You tell us why stuff happens. You're the only one that talks about why stuff happens. All the textbooks, all the board's review books, they just give you a list of stuff to memorize. They don't explain it, but you make sense out of things, and it's more fun. It's easier to remember. We understand it it's probably easier to remember because we understand it, but there's no one at the medical school that teaches this way, and they're so arrogant at the med school, and the books are so pretentious. And I said, yeah, I'm the best teacher because I connect everything and I explain why things happen. And as you well know, I'm actually banned from giving lectures at the local medical campus school because one of the attendings, who I made fun of their field to get back at me, they said that I made a joke that was suggestive of patriarchal misogyny. So they're okay with, KILLING babies, you know what that is. They make those babies into medications that people eat, so that's cannibalism. They castrate children from the grade schools who are confused about their gender for the moment. They encourage teenagers to commit suicide with medical assistants in dying. They euthanize old people. All of that is considered perfectly well and fine. They're like indirectly being shaped by pop you-know-what. You know what they're trying to control. Okay, but I'm a bad person because I made a fart joke in my book. It's ridiculous. And I said, yeah, and I've had other students tell me I'd be the best professor at a Big Ten college, but what would happen is I would sooner or later say something that some student thought was inappropriate. They'd write a complaint to management, and I would get fired. Okay, even though I was the most popular professor on campus, that's what the students all said to me. And I'll tell you why your textbooks stink. Because they're like a big warehouse. They're like a big warehouse of information. It's all disconnected. It doesn't make sense. And what they're really training you for between the lines is just how to sell drugs. They're not really teaching you what causes disease and how to prevent it. Okay, they're just giving you the background that you'll be able to sell drugs and surgery and imaging tests and blood tests when your time comes. The way I think is how is everything connected? How is what you eat connected to chemical absorption, to your gut lining, to intestinal permeability, to blood flow, to delivery of nutrients and oxygen to the tissues, to the endothelial glycocalyx, how that relates to the plasma membrane, how that relates to the cell cytoplasm, to the mitochondria, to the overall organ system, to optimizing cognitive function, muscle function, cardiac function. So yeah, I'm trying to figure out how do we optimize performance in the healthy individual and how do we prevent and treat disease. I'm trying to understand it, and I have a Christian perspective, okay? We're creating an image of God, and therefore all people are of value, not just the whole money system. And I see it as a beautiful, connected thing. And just like things are connected and coherent and beautiful in a cathedral, I said your school's approach of teaching, your school conventional textbooks, they're like a frickin' warehouse that's sort of dead, atheistic, and meaningless except for extracting money from people. Whereas mine is elegant and beautiful and understanding God's creation. Okay, and the only thing that's ever going to make medicine good is if it returns to Christian ethics that values the individual instead of abusing these poor proles, taking all their money, chopping them up, and selling them drugs that don't work. You see it in a beautiful Christian cathedral. The building goes with the altar, goes with the frescoes, the murals, the paintings. It's all magnificent, connected, and beautiful. And that goes with the missalette. It goes with the songs. It goes with the sermons. It goes with the Bible. It's all beautiful and connected and meaningful. Okay? And that's how the approach to understanding the human body should be too. And these people who say you don't need religion, they're full of crap. They want to keep religion out of it because if they can keep religion out of it, then they can keep on selling drugs and abusing the patients. So anyways, I just try to do what's right, And a few people learn from what I say and do, not many, but that's what's right. And that's the only thing that can save healthcare is if we care about that patient the way way parents care about a child, that they're the most important thing, more important than all the money, more important than pleasing an insurance company, pleasing a drug company, okay, pleasing the bean counter for the hospital by making more billing codes, more money for the day. We have to care about doing what's right by the patient. That's the only thing that'll fix it. No medical, surgical bullshitology, no new technology, nothing else can make a difference. So anyways, at least, when you learn from me how everything's connected from gut to brain, you'll know how to help patients. And most of them won't want it anyways. They're going to want to, keep with their bad habits. But at least you'll know what to do. You'll have that confidence. You'll have that understanding. You'll have that scaffold of knowledge to which you can add the other details you need to memorize for your test. So thank you for the compliment. I hope that helps. And then the medical student said to me, Dr. Rogers, I think you're right. I like your comparison of the warehouse to the cathedral. But man, are you arrogant.